Breast cancer, #1 killer of women globally. Check yourself to save yourself. And if you find something, say something. Early detection can save your life.
Hi, my name is Maria Jose Rodriguez. I am a patient of cancer for stage 2.
And she lives in Belize, and she is here to share her story. Tell us about your story.
Well, I was diagnosed in April in 9th stage 2 cancer. The way that I found out is that I usually do annual checkups. And it was my first mammogram that I did because it was I turned 40 in here in Belize. When you're 40, you do your first mammogram.
Mm-hmm.
And that's when I found out. I went to do my annual checkup, and they found something there that was abnormal.
Right.
And they asked me to do an ultrasound. And then when I did the ultrasound, I had to do a biopsy. When I did the biopsy, it came back as positive.
Did you do a needle biopsy?
I did a needle biopsy.
And how did that go? Did you have to pay for the needle?
I did have to pay for a needle. I was going to go through the government to KHMH, but it would have taken long to get the results. It would have taken months to get that result. So I had to do it privately at Healthcare Partners. And it was really expensive to do a needle biopsy.
Can you share about how much?
It was about $2,500 to do a needle biopsy, and it's the one locally. They send it to Belmopan, and then they get the results from here. It takes about 2 weeks to get it.
2 weeks if you pay for it.
Yes.
But if you can't afford it,
you go through the KHMH. The NHI clinic recommend you to KHMH, and then you do an appointment with Dr. Yakar, and then he would have gotten me the appointment. But usually it takes like 3-4 months to get the result, because you have to get a lots of tests to send it. So you wouldn't have a specialized like only yours. You have to wait on other patients so they could send.
And that's the issue here as well, because pathologists are hard to find here. So that was part of the delay.
That was part of the delay. And I did all my tests. I did it through the private sector. Through the private sector, because if I would have taken the government, it would have taken delay a lot.
Okay. So then you had the needle biopsy, and then you found out you had a
cancer.
Then
I found out I had a cancer, and then I had to do a CT scan, and which I did to find out what was the size of the tumor.
What was the size of your tumor?
It was 2.3, I believe. I don't remember that much, but he said that it was a stage 2 because of the size.
Yes, exactly.
And then that's how I got it. And then I was going to do it privately, the chemotherapy, but it was too expensive. It was about $2,000 per session. And
per session. That's 2,000 Belize dollars. So that's a 2-to-1 exchange. So it's like $1,000. Okay.
Plus
US.
the medication.
Plus the medication.
Plus the medication.
Okay.
So I said, then I heard about KHMH. KHMH does it through the hospital, and then it's way much cheaper. It's about $400 per session at the KHMH, and I do it every 3 weeks.
Okay, so that's happened. So have you had your surgery yet, or are you still waiting?
I'm still waiting. I have done 3 chemotherapy. In total, I am to do 8 chemotherapy, and then I will do my surgery here in Belize. I'm still thinking about it, if I should do it here in Belize, because we don't have a specialist that is specialized on breast
radiation.
No, it's on the breast surgery, because we do have surgeons, but it's a general surgeon.
Right.
So if I do it here, it would be a general surgeon that will do my surgery, rather than if I go to Guatemala or Mexico, it would be somebody specialized on the cancer, the breast, and that's what I'm afraid of, because I've heard that it has to be with your lymph nodes. So I'm afraid that I won't be able to use my hands, or I will have to do therapy on my hands. So it's kind of scary, because I'm still thinking about, you're just a general. You're not really a specialized
Mhm.
surgeon on the subject. So,
So access is important. Training is important for sure. And just so you know, just in conversation right now, will be that I'm hoping that we'll be able to train the general surgeons to do the lymph nodes, that sentinel node biopsy, which is the less invasive, which is where they check that first node. Yes,
yes,
that's what you're talking about.
yes, and I heard that when you're specialized, you go to the special lymph nodes that attacks to that rather than taking in all the ones that.
Correct. So that's called the
Mhm.
sentinel node.
Yes.
So my hope is that now that we have been on the ground and we've done all this teaching in regard to trying to get patients their breast wellness and then to identify these patients who have a cancer, my hope is that in the near future, I'll be coming back and training the surgeons on the sentinel node biopsy.
Oh, wow.
And then that way, that will alleviate that.
That would have been. I think we do need one.
Yeah.
I mean, I have learned that cancer is not a disease that it's rare in Belize anymore.
Well, you know, it's
It's
the
a lot.
most, yeah, it's
Yeah.
the most common cancer
It's
across the world in
yeah,
women.
and I thought that maybe because I wasn't paying attention, but now that it happens to me, now that I realize that we have a lot of patients, a lot of persons that do have cancer now.
Yeah.
I mean, it's amazing amount of persons that when I asked the nurse at the KHMH and I said, "Do you have patients every day?" She said, "Yes." They do chemotherapy from Monday to Friday,
Mm-hmm.
and every day it's full.
Yeah.
I mean, when I go to do my ones on Fridays, it's like it's 5 of us.
Yeah.
And it's most of them are breast cancer.
Yeah. And you know what's interesting is that in Belize, we don't have the actual numbers of people that have breast cancer, right? Because there's not a screening program. And a lot of people die in silence in the villages. And so the idea here is that we're creating breast wellness.
Oh,
And
wow.
so that breast wellness, it's like get your blood pressure checked, get your diabetes checked, and you know, just do a breast wellness check.
Yeah, and I think it's really important because, like I had said, I always say it's we women we tend to focus on husband, kids,
Everybody.
house, everybody. We don't focus on ourselves.
But the thing that people need to understand is that women need to take care of themselves before they can take care of
Yes.
others, right?
Yes.
So I think what you are is actually the reason I am here. You are the patient who was found early because you got your screening mammogram
Yes.
done.
And that's what we need. We need more women to check themselves more often than rather than waiting until it's not that on this final stage. Cancer is so silent because I didn't feel anything.
Right.
I didn't feel alarm. I didn't feel nothing.
Because you went for your screening. But you know what? We're trying to encourage women to also do a self-breast exam. And then if you feel something, say something. That is actually my campaign. That is the campaign, right? If you feel something, say something. So we need to let people know to do that one little thing as part of their wellness. Just check yourself. And then if you feel something, say something.
Yeah, I think that's perfect. And I am happy. I mean, I have had people coming to me and said, you know why? Because of you, I went to check myself.
We are the power of one. Let me tell you something. I strongly believe in this power of one, right? One person, one moment, one time. Everybody has the opportunity to impact. It's just what you do with that moment that matters, right?
Yeah.
So thank you so much for sharing your story.
Welcome.
I wish you luck.
Thank you. And I hope that every woman do take care of herself. I mean,
I'm into that.
This is a really good initiative. I mean, because
Thank you.
healthcare in Belize is really, really expensive.
It is expensive. And I know Belize is a poor country. I get all of that, but these are your fingers. People can use their fingers to at least do a breast exam.